Hello, Johnny.
Yeah, Priska.
Hello.
Yeah, I'm here.
Oh, okay. I wanted to be sure you guys can hear me.
Yeah, we can hear you loud and clear.
Okay, thank you.
Good evening, everyone. We shall start shortly. Just give us a few more minutes to set up. Good evening, everybody. I hope we are doing well today. Can you guys hear me?
Good evening.
Oh, thank you. I hope everybody is doing well today. And we are staying warm in this weather, this cold, raining weather. Anyway, so welcome to our Let's Talk Sickle Cell presentation for today. It's a sickle cell or sickle life initiative. Today's topic is Let's Talk Sickle Cell and Traditional Herbal Medicine. We're supposed to have 3 panelists. So if I see only Miss World available, Priska. Is Mrs. Perfect available? And Mr. Amponsa?
Okay, Johnny, Mr. Amposa is on his way here.
Okay.
Yes, Madra is also checking on Miss Perfect. So,
no.
Yeah.
Okay, so I guess we can start then. We'll have to just start with you for now, so everybody else gets in. Okay. So I wonder if we all know what traditional, herbal or traditional medicine is. Okay, a quick research will tell you that traditional medicine is herbal medicine involves the medicinal use of plants to treat diseases and enhance general health and well-being. Some herbs have potent or powerful ingredients and should be taken with the same level of caution as pharmaceutical medications. So yes, traditional medication actually does help, but it has to be taken with caution, just like any other medication. So Miss Will, Priska.
Yes.
I'd like to know, have you ever been introduced to herbal medication before?
Okay, so before I answer your question, let me introduce myself to our members here. My name is Priska Diditete. Yes, and I'm well known as Miss World. I'm a sickle cell patient with the genotype SS. Yes, and I'm a volunteer and an admin. Okay, so to your question, yes, I have been introduced to traditional medicine before, yeah, by several people, even including my mom. So yeah, that's it.
Okay, who was the first person to introduce you to herbal medication?
Okay, I can't say or pinpoint, but I will say that it's my mom. My mom has been my caregiver, so anything I take is actually coming from her. So the first person, okay, she will be the first person because she gave me the first herbal medicine. Yeah.
Okay, and what was your first impression of it?
Oh, it's funny though. So I didn't like it. Truth be told, I didn't like it. I don't think anyone.
Was it the taste or how you felt, or why didn't you like it?
The taste and the smell. Yes. Like
the smell. Okay.
I didn't like the smell and I didn't like the taste because it was extra bitter compared to the pharmaceutical ones that I've been taking. That one was extra bitter, yes. And I couldn't stand the smell. So yeah, basically that was my first impression coming into contact with a traditional medicine.
And how did it affect you the first time you took it?
Okay.
I'll just take us through your first experience. What happened?
Okay, so my first experience was my mom is a trader. Yeah, she's a market woman. So you know all these market women, people coming to advertise this medicine to them, and they don't know anything. Like, so they just buy because the person says it cures this, it cures that. So, like I said, she used to work at a Blushi. So I was a kid, and one day she came home with this jar. It's not even a jar. It was the girls among the women among us, you know, when you buy a relaxer, the container it comes in with, That was what it was. And she hasn't opened it, so, but there was a spill. So I could see a purple color on the container. So I asked her, Mommy, what is this? Like, this looks like a poster color or something. Then she was like, oh, today somebody came to and was like, this cures stomach upset, this and that. Okay, so growing up, my crisis was basically always. Sometimes the food I eat will end up with stomach upset. Like I'm always having pain in my tummy. So when she heard that this thing can cure like stomach upset, she bought it. Then I was like, the moment she said that, I know, she will give it to me. Like no matter what, she's going to give me that medicine because we're honest. My stomach will pain me and she'll give it to me. So at once she didn't give it to me. She said when the child is is feverish and has hot temperature, so you can rub it on the child and the child will be cured. So we were there like about 2 weeks later. Then my stomach came again and I was in pain and my body was hot and all that. So she rubbed some on my body. I didn't, even when she was rubbing it on my body, like I didn't like it, but what can you do? She's your caregiver. So she rubbed this on my body. Then she proceeded to take a cup and a spoon. She fed some, and the thing looks like a gel, but it's purple in color. Me, I call it liquid soap because it's just like liquid soap that they've added the purple color to. Then she mixed the thing in a cup for me, added water, and the thing was foaming. It was actually foaming. I said, Mommy, this one, I can't drink it. She said, no, it will make you feel better. You see that, like 10 minutes, we were talking about this medicine. Then I said, okay, let me just drink it so that this woman will leave me alone. I drank the medicine, and 5 minutes later, like I was worse. My symptoms became worse. I was just vomiting. Like within 30 minutes, I vomited like 10 times. I was just vomiting everything in my stomach. I was vomiting everything. And because when you vomit frequently, it leads to dehydration. So I was very weak and like I became worse. And her sisters were like, why did you give this thing to her? You have to take her to the hospital. She was like, hey, the nurses will like insult me, so I can't take her to the hospital. And this is it. They asked me, what did I give her? But then she doesn't want to see me closing my eyes because sometimes I'm so tired and I just want to sleep. I feel like sleep should just take me away because I was in so much pain because of that medicine. And anytime I try closing my eyes, she will be like, Jesus, someone be like, if you're a guy, you say like, Jesus, save my daughter. So I was like, in my head, I was like, you want Jesus to save me after what you've done. So she had to take me to the hospital eventually. Then that was solved and all that. So when we came back from the hospital, like days later before we came back from the hospital, then nobody told her to throw it away. She just threw the thing out. I was like, hey, this medicine there, it looks scary.
So after she rubbed it on your skin, then she made you drink it. Wow, that's interesting.
Yeah, so she rubbed it on my skin for the temperature to go down before proceeding to mix some for me to drink. So that was what happened that day. I was really upset. Yeah.
I can imagine. I see we have Mr. Ponsa on the line. Mr. Ponsa, how are you doing today?
Please. I'm doing very well.
If you can introduce yourself to our participants.
Introduce. Okay. Yeah.
Yes,
I'm a member of Sickle Life. An SCD sufferer with SS genotype.
Okay.
Yeah. A staff of Care University with the finance office of Care University. Currently posted to the faculty of Agric. Yeah. So that is a brief about me. Yeah.
Okay. Thank you very much and welcome.
Thank you.
So today's discussion is on herbal medication. What's your experience with herbal medication?
Yes. Honestly, I've been very careful with any medication that has not been prescribed. But along the line, when reading and listening to, a lot of people were giving me suggestions as to what to take, herbal medications, different types and all that. But I was very strong in avoiding all that. My mom was also an SCD person with a SC genotype. Yeah, so she also had a lot of such experiences. I remember growing up, she once wanted to try. And so she came up with one, and then I didn't actually help. And then I was having these leg ulcers. And then my dad went to bring this greenish kind of, I think it was herbs that they mixed and all that. Honestly, it did a trick. After some time, the leg ulcers went away until just this 2007 that it started and has been on. Unfortunately, when my parents just passed the following year, the leg ulcers came as if they were afraid of my parents. Yeah, but now my senior brother keeps on saying that if we knew, we should have asked old man, that is my father, where he took that medication from, that herbal, those herbs from. It was not to be taken in ingested, but then to be smeared on the feet. It was doing a lot of help. Yeah, but after that, the one that my mom wanted to try, I remember that one we tried and tried and tried. I couldn't even swallow it. Thank God I couldn't swallow it. So whilst some few years back, I told myself, no, there should surely be some medication, a herbal medication or that kind of thing that could help. And so I started reading, and then thereabout, I got to know about
Mr. Ponsa, I think we lost you. Mr. Ponsa, are you there? I think we've lost him, unfortunately. Yeah, it's probably not due to the network. I'm sure he'll come back shortly. So, Priska, back to you.
All right.
Yeah. Do you think herbal medication can cure SCD after what you've heard from Mr. Ponsa?
Okay, I don't that. Yeah, people actually say there is a cure to sickle cell, but within growing up to the age and finding things out myself or researching myself about what I have, I know there is no way anything can cure it. Maybe to subdue the pain or cure malaria or something, but STD, I don't believe so. I think so. Yeah.
Okay. How often do people recommend herbal medication to you?
And demand to my mom, like, do this for her, do this for her. Because I don't know, I don't opportunity with that. And there was this man who has physical cells, children, like two boys, one boy and one girl. And they lived opposite my house. So she was like, mommy was like, this woman has been doing everyone for the kid, and they look healthy. So she was going to ask the woman to come and teach me so that I also do the same thing. So the woman actually came to me and told me that, this is what I've been doing for my children, and they look healthy and fine. So you have to do it. I was like, okay, so what is it? Then she told me, then I said, I won't get the time to do all these steps. So it's better when you put maybe for me, then I try. So she first once I didn't go well. It didn't go well. But then she said I can't do before, and so it was. The door was like silly. I read the and she didn't present okay, so by any story. But to cut the long story short, one of the children died that day, male. So if the steps were really working, the guy is still alive.
Humans have died. That's true. I think we're losing this world. Priska, we're losing you.
Hello.
Oh, Mr. Bosa, welcome back.
Yes, thank you very much. I want to finish, then I can continue.
I think she's off, so you can go ahead.
Okay, yes. So as I was saying, but before I go on, please let me ask if Dr. Sam is on. He's very eager to join. So if he's not on, if Majwa can help get him on it, maybe he's having some challenges. Yeah. So that is, I contacted Center for Scientific Research into Plant Medicine, Mampong. And then also I made inquiries at the Faculty of Herbal, Department of Herbal Medicine, KNUST. Hello?
Yes, we can hear you.
Yes, so I started the, Mampong people were able to give me some medications which I've been taking for almost a little over a year now, which has been good so far. So far, so good. I stopped taking the hydroxyurea. I was taking it and I was still having leg ulcers and other complications of sickle cell, as we already know. And so I was like, what is the essence of taking this hydroxyurea, which has been so much trumpeted? So I lost hope in it and I stopped at all after altogether. So, and then along the line, I got another man at the Herbal Medicine Department at the Faculty of Pharmacy here. And then he also started giving me some medications, which has also, just yesterday, I even went to him to take some. Yes, which has been, yes. So I think with these two institutions, I'm very comfortable with them. Why? Because they are research institutions, they are recognized by the state, they are being run by responsible people who are into research, wanting to know more and all that. So I was like, if, for example, us, Sickle Life, if we could partner with these two and then encourage and help them, let them know that we are also interested in their work. Then maybe, who knows, with time, these many side effects of the hydroxyurea and other medications that have been worrying us, who knows? For all you know, we have very good medication here with us. Because let me be a little bit religious, even though I'm not all that religious. But I know God will not give anything without a remedy. Yeah, so this will be my initial contributions. But as I said, if Dr. Sam, Faculty of Department of Herbal Medicine, KNUST, is not on it on the show now, please let somebody help him to come on. Yeah.
I think we're trying to get him on. So, or is he on? Dr. Sam, are you on? Okay, I don't think he's on yet. So we'll try to get him on as soon as we can.
Well, he's very eager. He just called me just about 5 or 10 minutes ago.
Okay.
Yeah.
Okay.
Yeah.
So with your experience, you think herbal medication is not the best, but it's helpful with sickle cell disease?
Yes. We can't say, that's just as you put it, we can't say it's the best now, but then it's actually helping, at least with my personal experience so far, having taken it for a little over a year now. So far, so good. So far, so good. Yes.
So I believe herbal medication has come a long way from, I'll say, when your parents were giving you the medication. I think there's more research been put into it, more money. So I think this is something to look into.
Yes.
Yeah. And so do you think the herbal medication has a lesser side effects than conventional medication?
Yes, because this is organic and not like nature-based.
Okay.
Not these ones that are laced with chemicals and all that.
Okay.
So at the end of the day, we take them, that is the orthodox ones, and we have even these normal painkillers, when we take them, For example, when I take, now I'm having a little bit of, because of the weather,
yes,
some slight pain. So I take this normal paracetamols. They don't do anything. So sometimes you are tempted to go and take this tramadol and this Doretha and those things. But then at the end of the day, when you take them, you feel within your body the side effects that they are giving you. Unfortunately, yes, as a man, actually with the hydroxyurea, one of the side effects was I nearly became impotent.
oh, wow.
I went to check my sperm count, and it was, I think 0 was even better than could be said. It was next to 0, if I should put it. Yeah, but then when I stopped taking it, and then started with these Herbal ones, it started coming up, and now I'm becoming like myself again.
Okay.
Yeah.
That makes sense. Well,
Yeah.
just so you know, just to everybody else on the page, I think for medication like that, you need to see your doctor and they'll recommend, because everybody reacts differently to hydroxyurea. Yes, sir.
Hello.
Yes, sir. I see a Techno F1. I'm not sure who that is. Sorry, your line is very, very bad. We can barely hear you. You might have to reposition yourself.
Okay. Okay.
Okay, let's try again.
All right.
The line is still very, very bad.
I think that is Dr. to come on.
Oh, that's doctor. Okay.
Yeah, I think that's it. Yeah.
Dr.
One
Sam.
thing I'm fascinated about Doctor is that he's done extensive research into the subjects. Yeah, that is sickle cell.
Dr. Sam, if you can put your video off, maybe to increase the bandwidth so we can hear you properly. Yeah, try putting your video off. It will increase your bandwidth. Okay, let's try again. Okay, can you talk and let's see if we can hear you. Yes, it's much better. It's much better.
Can you hear me?
Yes, it's much better.
Right. Okay. I'm happy. Right. Can you still hear me?
Yes, we can hear you. You can go ahead with your submission.
Oh, yeah. I think like 3 days ago, so that a gentleman came to my office. Can you hear me?
Yes, you can hear you.
Yes. Can you hear me?
Yes, yes.
You can hear me now?
Yes, we can hear you.
All right. So he narrated exactly some of the things you have been discussing right now. And I was very much fascinated that in the end, they've been able to touch a reliable piece where we can rely on for safe medications. And that is the Center and the Faculty of Pharmacy. Can you hear me?
Yes, we can still hear you. Go ahead. Yes, go ahead.
So I told me about this Zoom, and I was glad to be part of this discussion.
Okay, you're welcome, sir.
Like they say, like the experiences people have narrated is taking medications from people who are not qualified or do not understand
Dr. Sam, the sound is has gone bad again. I don't know if you can move around. The sound has gone very low.
Is it okay now? Is it okay now?
Okay, okay. Talk and let's see. I think it's better now.
All right. Yes. So finally, the gentleman who came, I was fascinated, like I was saying, because he told me the experts, basically they have tried, they have tried, and I was very, very sympathetic with their situation. That it has taken them very long to know about Mabon, and then about the faculty of pharmacy.
Mr. Sam, Dr. Sam, I think that is it possible you can log off and log back on again? The line keeps going off and on. You can log off and come back on again. Yes, sir. Thank you. Okay, let's try that and see if it works. Thank you.
Okay.
Oh, wait, I think it's back now. Can you talk? Say something. Okay, so we had to let him go. I'm sorry to be back. The line was very, very, very bad. Can you guys hear me?
Yeah, I can hear you.
Okay, thank you very much. So from your experience, Mr. Aponsa, do you think it's right for a health worker to recommend herbal medication to a patient?
Well, with the orthodox people, I don't know, but experienced it. And like, for example, for the academics amongst us, and for our orthodox people, almost all of them are academics. Yes. So if they can liaise with our counterparts from, let's say, the Herbal Medicine Department of Care University, and then also for Mampong, Scientific Research into Plant Medicine, to get the basics for the medications that they have developed for sickle cell and its related activity, its related issues, then maybe they could begin. But actually, what I know is that some of our hospitals, for example, the Kumasi South Hospital here has a herbal medicine department that has a herbal person who is qualified to sit there and then also receive patients and then diagnose and give medications, herbal medications. So if this could be taken further, and then if our orthodox people could partner for the love of us as sickle cell persons, and then also to reduce costs. I don't know much, but I know hydroxyurea, for example, is giving costing the government and other stakeholders a lot. So if we could partner our own and then help them to research further and then develop whatever they have now, I think it will go a long way to help. Because so far, as I've taken it over a year now, I think I have nothing to complain about. It's actually helping. It's actually helping. Just that I think there is still room for improvement.
Okay.
Yes. Yeah.
Well, thank you. I think, Briska, what do you think?
Okay, so about health workers recommending herbal medicine to guardians or parents or whatever, I don't think that is right, because I remember one time I was in the hospital and this nurse came to my mom and was like, so go and buy this and cook for her. And my mom listened to that person because my mom thought like she had more insight and went to buy, and the medicine is very bitter. Like who accepts to recommend anything?
I think your issue is the bitterness of the medication mostly.
Yes, and it's not right. Like, we came to the hospital because that's where we think we can get solutions to our health. Then you refer us to go back to the market for this marketing to sell herbs that we don't even know how hygienic it is for us to consume. Like it doesn't go, that doesn't go well with me at all.
Okay, I agree with you, because I think also, like every other medication, everyone reacts differently towards the medication. So it could work for me, but it would not work for you. Like Mr. Posa was saying, he's off hydroxyurea, but he's not having the issues he used to have when he was on the medication. I think we have a question from Atia Dangate.
Yeah, good evening and good evening to everyone.
Good evening.
Mine is just a contribution to what's being said. Mine is just a contribution to what's being discussed or the topic being discussed, right? Okay. Now, myself, I have kids which are also sickle cell patients, right? And in fact, initially we started with going to 37 day in and day out, and we were also introduced to the hydroxyurea. Then later we also tried going for clinicals at Kolebu along the line. But along the line, we also got introduced to one of these herbal medicine. And eventually we engaged a renowned, a doctor who is into herbal, herbal medicine. And in fact, since like our colleague who just spoke before the lady, in fact, since we were introduced into it, to God be the glory. I don't know whether it is about the immune system of each and every patient, but what we found out was that when he introduced the medicine to us, and we got into it. Since then, we've not been to the hospital ever since. Wow. And he told us what we shouldn't do. You understand? And what the medicine don't like. What a lot of people, all patients with sickle cell, don't know about taking of beans, our normal beans we eat. It's very deadly. And he himself is a sickle cell patient. His father treated him with the same medicine, and he has treated a lot, including doctors even on this page. And he's very renowned.
Hey, which doctors on this page?
There goes. I like that. I like that. You understand? A lot of people know about him. But in Ghana, you understand. When one say herbal medicine, then you see people start raising eyebrows on the person. Because, hey, why herbal medicine? How is the intake of it? And because of how to calculate how to introduce or infuse the medicine into the body of the patient, it's not calculated. A whole lot of myth around it. So people on the page, I think I even called the doctor to even join on the page so that he can also, enlighten us well. You understand? And to me, for instance, since we were introduced to it, my case have never been to the hospital. And day in and day out, we have the instrument in checking their blood level. Always it is very high. Initially, they were being transfused every month, monthly transfusion. We go 37, we do monthly transfusion, day in and day out. And since then, if I check their blood level, day in and day out, in fact, I never thought we could even have such thing in Ghana. I never thought. But to God be the glory, there is one in Ghana. So the herbal medicine, it helps a lot. But just that sometimes how we use it, like our lady was talking about, is the problem. Sometimes we use it in excess. That creates the problem for us. That's the only thing I can also say. So thank you very much.
Thank you very much too. Like I said before, we all react differently to different things. So what might work for you might not work for someone else. So I'm sure there's more research going into this, and hopefully very soon we'll know more about it. Dr. Bankas, you can go ahead.
Okay. Hello, everyone. Good evening. I think that this topic is very, very important, and I'm happy that it's bringing out all the different perspectives. So the first thing is that what Priska shared about people contacting her mother and telling her about using certain herbal preparations. It's a very common story that we hear in the sickle cell community. Every time someone is advising us about some preparation that can help us. And these days, it's not just the pure herbal medications. It's some of these multivitamins that the multi-level marketing people are selling around. And sometimes we don't know what is in them. And so they may have certain ingredients that are not safe in sickle cell. So everywhere we pass, someone is recommending something to us. And I keep hearing these stories about recommendations for us to use herbal preparations. So it's a very, very key point that Priska mentioned. Dr. Sam started talking. We couldn't hear everything that he was saying, but he raised a very, very important point about people using herbal medication from unregistered and undocumented people, or charlatans, basically, people who don't know much about the herbal preparations versus people who are regulated. For example, those who have gone to the KNUST School of Herbal Medicine. And that's what Mr. Mponsa also alluded to in terms of the medication that he was taking. So I think that that's also a very important point, that not all herbal medicines are the same. However, I'm really looking forward to Dr. Sam coming back and giving us more clarity on this matter, because the person before me has spoken about how, for example, his children's blood level have gone up and now they are no longer getting crises. And Mr. Mponsa also talked about how his leg ulcer is improving. But the question is, what exactly are those medications doing? How exactly are those medications affecting sickle cell disease? Because just last week on our support group, we're talking about even for orthodox medicine, for sickle cell, there are the disease-modifying medicines, and then there are the supplements. So you can be taking medicine that is making you feel good. It's treating your anemia. It's making the jaundice less, right? But it's not doing anything to the sickle cell disease itself. So you are still getting the complications. In some time to come, you may still get kidney disease, or you may still get retinopathy and go blind, right? But then today you are feeling good. You are not anemic. You are not pale. You are not jaundice. Understand? So we need to. I'm hoping Dr. Sam will come back so that he tells us these medications.
Yeah, he's back actually.
Okay, so then we want to know, how exactly do they affect the sickle cell disease? Are they targeting some particular part of the condition such that the person is not going through the sickling process, or it's just symptomatic management? Because even in orthodox medicine, the world is moving away from symptomatic management of sickle cell disease and focusing on dealing with the pathophysiology of the disease. And another thing too is, as you said, for Mr. Mponsa, for example, he said that he had challenges with his sperm count and fertility. That is a recognized complication or side effect of hydroxyurea. And so it's something we look out for. On the other side, with these herbal medications, often you don't even know what the active ingredient is and what the side effects to look out for are. So then it makes it difficult, because what if you are taking this medicine and today you feel good, but then subsequently it's going to result in something else? So these are things that we should be cautious of, especially for the gentleman who spoke before me. Yes, you may have sickle cell and your blood level is going up, but then even for hydroxyurea, there are some people we won't give it to, because we know that if you have sickle cell and your blood level goes too high, it will cause hyperviscosity, which means that you will get a stroke from the sickle cell. Understand? So we don't want people with sickle cells blood levels to go too high. Understand? That's why we say, for example, don't take iron medicine, because when you take iron medicine, your body's already releasing iron. So that's also another thing that we weigh. So all these things are put into context. So fundamentally, we need to understand what the active ingredients in these herbal medications are, their mechanism of action, and also the side effects and how they interact with other medication. Thanks.
Okay,
I do appreciate. And the doctor I spoke to, he's on the line. He's something Kobina, so he's on it. So we can also ask him one or two. Okay, thank you.
Okay, so Mr. Sam, can you let's try your line again. Oh, sorry, Dr. Sam, sorry.
Yes, sir.
Okay.
Hi, everybody.
Can you hear me?
Yes, can you hear me?
Let's hear Dr. Samuel. We can go to Dr. Kobina.
Okay.
Yeah. Can you hear me?
Yeah, Dr. Samuel, we can hear you now. Please go ahead.
Me, please?
Yes, we can hear you.
You can hear me now.
Yes.
Right. Yes. Like people, this discussion is going, and people want to know how the medicines work, their safety, and so on. And I was saying it is safe for us to go to places where they are recognized as people with the requisite knowledge in preparation of herbal medicines. Please, can you hear me?
It's a little bad. So it's a little bad, but I'll try to say what you're saying.
Okay now.
Yes, so pretty much you're saying it's better for people for us to go to people who are. You're saying we should go to people who are recognized as herbal practitioners and not just anyone.
Institutions.
An institution, sorry, yes, institutions.
Have been recognized as now. I think we have to understand some aspect of this secret. Can you hear me?
Yes, go ahead.
Can you hear me?
Yes, yes.
Now, basically, what we are experiencing as secret comes from one fundamental mistake that the body does. And that is in our body breakup of our DNAs, and I don't know if I'm going to be technical. The technical thing there, which is probably intelligible to many, will be that a compound called glutamic acid,
okay,
which should be there, has been replaced with a valine. These are all amino acids. So the replacement of glutamic acid with valine is the cause of all these line problems we're having with sickle cell. Can you hear me?
Yes, so sickle cell is caused by the replacement of what? Oh, I can't remember. I can't pronounce the word you used.
It is just a small mutation.
Okay, a small mutation
of the protein.
Okay.
Glutamic acid has been replaced with valine.
Glutamic acid has been replaced with
valine.
Valine. Okay. Okay. So that's the cause of sickle cell.
Now, yes, both are amino acids, but they are not of the same character.
Okay.
Like people say, we take something supposed to treat us and they give effort. Even if it is orthodox medicine, herbal medicine, where what you are giving has a lot of this valine, it's an amino acid, then it's going to aggravate your situation.
Okay.
So what we should look out for in checking what we want to take.
So it depends on the ingredients in the medication.
People the ingredients in the medication and what it is doing. Basically, sickle cell anemia can be first managed and then treated with a combination of medicines. The medicine must be said that it will keep your hemoglobin level at a certain level, reasonable levels. Okay. Then it should be a medication that will be able to open your blood vessels and allow for blood flow. Because basically why there is this concept pain is that the blood vessels have acquired some shape that are unable to pass through the tiny blood vessels, and therefore they block those vessels and give you the pain. So that medication must also take into account the property of opening up those blood vessels. So characteristics of this treatment, it must give you some level of enhanced hemoglobin, that is blood. It must be able to open your blood vessels, and it must be able to modify the shapes of the sickle cells.
Okay.
These are the reasons for treating the condition. Now, people with experience, maybe most of what we see that they may have the experience of combining one or two plants to give you the medication. Some of which may work, some may not work, like somebody had already said, depending on individual's reaction to the medication. If you are treating a condition and you take 100 people, it's not likely all the 100 will respond well.
The same way, yes.
People definitely will all one out. But if you get 2 or 3 people, that's good enough. Yeah. So I will suggest that people on medications for sickle cell should take the medicine and examine themselves after a maximum of 1 week to see what is happening to their body. If it is not good for you, it's better to report back to either continue, discontinue, or change the medication.
Okay, but I have a question though, so, if you don't mind.
Yeah,
yes.
No problem.
Yeah. How much research has gone into the medication for sickle cell, the herbal medication? How much research has been put into it?
I think there was one man called Ahulu, if you have heard the name before. That man spent all his time researching into sickle cell. Can you hear me?
Yes, you said someone spent all his time researching into sickle cell.
Yes, and he has extensive records of all the research that he did. Then, I was there for 15 years.
Okay.
And again, a lot of patients came with the sickle cell that were actually taken care of. And not much research had gone on at the time of the work was still going on until I came to the university. Now, here at the university, the research hasn't been that rigorous because the department lacked, in fact, the department lacks funding to go into detailed research finding over that very long time. We don't get quick results, but we are still going on with the research. What we are trying to do is trying to understand the various preparations that are being paraded around as treatment for sickle cell. Take them in collaboration with the herbalists. Normally we have seminars, symposia with them, and try to understand what they are giving out and how best they can make those preparations safe. We've had series of conferences, workshops in this area. First, the safety. Then we jump into efficacy. I think it is this efficacy that where we are reached now. And we are trying to sum up a number of preparations to now look at the efficacy using various models. Now, with safety, we look at the toxicity as the first stage, and also we look at the chronic for occupations that come to our hands. So I would say much attention paid to sickle cell research. In fact, we've done more in diabetes and gonorrhea, those very rapidly and very common diseases more than sickle cell.
Yes.
So,
Dr. Sam, the line is now going very, very, very bad.
Yes, the line is going bad.
Yes. Here it's raining very, very hard. I don't know if that's the reason, but the line has gone very, very bad.
Hi,
Can you hear
Johnny.
me now?
Yes, Dr. Bassett.
Yes, so while we try to sort out Dr. Sam's line, let me just try and give a summary of what he said for those who didn't hear. So he basically said that sickle cell disease is because of a substitution of valine for glutamic acid. There's feedback.
It's good now. It's good. Oh no, it's still there.
Hello.
Yes, go
so
ahead.
I'm saying,
Hello.
Dr. Sam was saying that sickle cell disease is because of a substitution of valine for glutamic acid, which is something we all know. If you take in any medication or anything that has a lot of valine in it, can you mute Dr. Sam for now? I think the feedback is from his side.
Dr. Sam, can you mute? Hold on. Okay, go ahead.
Yeah, if you take in anything that has a lot of valine in it, you are aggravating the sickle cell disease. So what they do is that they produce medication that addresses the challenges or the pathophysiology of sickle cell disease. So he mentioned that, for example, the medication they produce, what it does is that, first of all, it should be able to cause the vessels to dilate. That the vessels should be able to expand, increase, so that they don't get blocked, because we all know that that is what will cause some of the pain episodes that we have. And then it should also stabilize the blood level, which is what he said, right?
Okay.
So that's basically, if I'm remembering correctly, that's how the mechanism of action of the drugs that they produce. It stabilizes the HB and it causes the vessels to dilate so that you don't have the pain episodes. Then he mentioned that in the question that you asked him, that for research that has been done into sickle cell disease, granted, not much has been done for sickle cell compared to diabetes and other conditions. However, they look at the safety of the medication in terms of its toxicity and also the efficacy. So they are looking around at the herbal medicine producers around to gather their medication to see whether it's doing what it claims to do. So that's what they were doing at Mampong, where he's worked for about 15 years, and now I think he's moved to KNUST. Yes, and then he said that if you want to know whether the medicine works, you can get it and try it for a week and see whether it works. But then for me, I have a challenge with that. So that's going to be my question. That's in line with your question about research. Have there been any clinical trials, randomized control trials, such that one person is on his medication from the center or KNUST, and one person is on a placebo, and then we compare them and then see that, okay, of 200 people who were in this study, 100 on trial on the placebo, 100 on the medication, this is the reduction in the amount of crises, or this is how many leg ulcers were improved. Then that one, it has more power statistically to be used compared to saying that somebody should buy their medicine and try it for a week. Also, we've still not gotten clarity. So for example, you saying that taking things that contain valine will aggravate the crisis. Since it's herbal medicines, and when we talk about herbal medicines, people assume that it's about the food you eat and things like that. So people are always saying we should eat turkey berries and stuff. Is there any identifiable, let's say, plant or food that contains a lot of valine versus, let's say, those that contain a lot of glutamic acid? And so you've extracted those, you've extracted your active ingredients from those kinds of foods or fruits. And so those are what you use to make your medication. Other than that, you've just given us general pathophysiology, but you've not told us what exactly is used for making the medication that, for example, helps Mr. Amponsa's leg ulcer to heal. Thanks. I'll be doing like summaries in between because we can't really hear what he's saying.
Dr. Sam, did you hear the question? Yeah, Dr. Sam. If you can unmute so we can hear you.
Yeah, I've done that.
Oh,
can you
perfect.
hear me?
We can hear you a lot better now.
That's good. Yes. Like you were saying, the line was always cutting, going off and on. Now, in herbal medicine preparations, we don't at this stage attempt to take the individual compounds from the plants. So we don't isolate valine or glutamic acid as an individual ingredient in formulating a product. Because normally these things in plant come conjugated with other modifiers. So you take the whole thing holistically, sometimes 1 or 2 plants put together. And at this stage, it is very difficult for individuals who are taking the medicine to know this is glutamic acid containing plants or this is valine containing plants. But luckily, the WHO has come out with a number of plants that we know that contain a lot of these compounds as a guide. But even that, we don't take the individual isolates, as we call them. Because one problem with our orthodox medication is the taking in of the individual isolated compounds. And they invariably have side effects that probably we don't know. Some we may be able to know through experimentation, others we don't know. And even those that we say we know, I don't think we know everything. So this herbal preparation, you take in the plant preparation as a whole, because there are a number of modifiers. So that if there is some undesirable thing about a particular compound, pure compound, there are other modifiers to cushion its negative effects. So far, we are not taking the isolate. We take the whole preparation. If it is a leaf, a soup, you take it as such. But we need to know that if you are giving something recommended and you take 2-3 days, the thing is not doing anything good to you, it's not helping you, I think you should quickly drop it and inquire from whoever gave it to you, ask more questions and let the person know the feedback, get the feedback and see whether he has to modify it or take something out, rather than trying to say, oh, like we also usually say, the medicine has gone to touch the disease, so the disease is getting aggravated. No, I don't think we can go along with that notion any longer. Yeah. So regarding the individual isolates, that how far I can go with the isolate. We don't take the isolates. We identify the plant, check the safety, and then it is taken whole. Does it answer the question?
Yes, I believe Dr. Bankas had a second question in regards to research. Dr. Bankas.
Yeah, regard to research, I was saying not much rigorous research has gone on since the death of Dr. Ahu. He spent all his time researching into sickle cell, and he has a lot of data on sickle cell. Now, during our time at the current situation and now as we are speaking, there isn't any concerted effort to research into sickle cell, except that where on-demand medications are prepared, a safety assessment made, and individual client given the medication. Like people have been going around taking something from individuals from, say, the university, from everywhere. People also come to me as individuals. But as a concerted, well-organized research into sickle cell, I don't think the department is taking on that yet. So when the gentleman came 3 days ago or so, I was happy that he has come to arouse our interest in the area of sickle cell research. And I promise that we'll put a few teams together and reinvigorate our research. We did a little research at Mampong Equaping when I was there. I was there for a number of years, standardized their products, because when I went there, it was just like the herbalists were doing. So after the standardization, treatment, the secret said, and the number of diseases, data is there, but I don't think it's good enough to say that is considered research. So back at the university, I don't think there has been a remarkable improvement in the research towards sickle cell. I think more work has been done in areas of, say, diabetes, gonorrhea, and other diseases more than the sickle cell, seriously. So I think now we can pay our attention, redirect resources, form a team, and look at certain research into the sickle cell situation. Yeah.
Thank you very much, Dr. Sam. I believe Prof. Konotia Hulu is still alive, but he's in the UK. But there's still, well, yes, I think so. I'm sure someone can check on this. Yes, I know there's still research ongoing. At least.
Yes, I'm not sure if, but I checked on, I wanted to ask something. Somebody told me, oh, the man is dead. See?
No, not, maybe you're Hine Frimpong, but Konetia Hulu is, I think he's still alive. Yes, but then in terms of research, there's still some research going on in the orthodox medicine sphere. So maybe we should have further discussions later for what can be done, like what collaboration we can do in terms of herbal medicine, because again, using our setting and the situational context, people are more comfortable or confident with herbal medicine. And so if there's a space for that, then we also need to know what exactly people are taking. So we need to find out, as you said, the active ingredient is not extracted. But for example, if after this meeting today, we go back on our support group and we are discussing, and other people who have leg ulcers want to try what Mr. Mponsa is taking, and we don't know like what exactly is in it, it's very difficult to then recommend it to other people, because even for us here, for the orthodox side, we're also trying like different preparations to see what works best for like things like leg ulcers. So I think that will be important for us to have this collaboration. It's not like we have loggerheads or anything of the sort, but we just need to understand what exactly these preparations are doing. I just want to find out, so in terms of your preparations for herbal medications, you said something about if the person takes the medicine and it's not working, they come back and then like tweaks can be made. So is that to suppose that the preparations for these medications is not on like a wide scale basis? For example, using hydroxyurea, it's a standardized preparation. Everybody gets hydroxyurea, just that is calculated per kg. So if you are smaller, you get a certain dose. If you are bigger, you get more. But then this one, you are saying that if I take it and something is happening, I come back and then you make a change to the formulation itself. Did I understand that correctly? Dr. Sam, please, you are muted.
Dr. Sam, please unmute yourself. And Dr. Corbin, I haven't forgotten about you. We'll still get back to you.
Okay, am I okay? Am I okay? Oh.
Yes.
Am I okay?
Yes, yes, we can hear you now. We can hear you.
Yes. I was saying that in the context of those who go to individuals for medications, for sickle cell, some of these preparations, they themselves don't even know the sort of thing they are giving to people. They know it works, but what is it that they are given? I think, honestly, many of them don't, many of the herbalists don't know. Now, for such people, if you take from them and it's not doing you any good, it's better for you to stop quickly and go back to questions, ask questions. Now, with established institutions like the center, Mampoint Kwapim, or the Faculty of Pharmacy, no, anything we get up, these are surely going to be standardized with the dosage determined before it's given out. And it's not a random preparation or random dosage. No, we'll establish the dosage. The risk is with people, you take individuals, you approach them and they prepare something for you. I don't think they know all that goes into pharmaceutical preparation. And so those are problems. Some of them may work all right, but still there are risks. And that was what I was saying. Now, regarding the research, yes, the department hasn't gone seriously into sickle cell research, except that, like my friend Mr. Asari there, I'm also there, that if individuals come, something is prepared and given out. Now, normally, if somebody approaches Mr. Asari, we work together closely, and I'm in the know. We establish the dose. We try to do a number of things before we give them out. But if he is approached and he is alone and the department doesn't know anything about it, then we can't say much about what is given. See, regarding collaboration with the Orthodox, I think it would be a very good idea. Because, you see, research can be done with herbal medicines to find out what is in there and the mechanism of action. You said, oh, herbal medicine is taken like food and the body processes. No, I don't think that's correct. Because I worked on a plant. The plant is for pain. And any pain due to spasmodic action, so that it will try to calm it down. So basically it is antispasmodic. Now, people were chewing the plant. You just chew the bark. So I tried to find out what is it that people are taking. I worked on it and I realized that it has 3 basic compounds which are responsible for the activity. And they are anticholinergic and antihistaminic. And they work very well. How did I do that? I did fractional, sorry, activity-guided fractionation to find out which fraction has the active compound. I screamed it down, narrowed it down until I got a fraction that contains those 3 active components. But in this case, I actually isolated them and characterized them, and we know what they are completely. But still, we don't formulate products from just the pure compounds. We still use, at very best, the fraction. That is the total extract. But traditionally, importantly, we use the whole plant. So if we are working and collaborating with the Orthodox, we can go into the chemistry of the herbal preparation, align it with what is given in Orthodox environment, find out whether what the plants are, people are giving to patients as plants don't contain exactly or some of what is given in Orthodox medicine. It could be, you see? So that collaboration will be very good. I think it will be very, very good if we can do that. And like the example I have given, now we know if we're given that plant, it's a powder, giving it as a powder to individual, we know exactly what the person is taking. We know how much of each active ingredient is there. And even the isolates, we went further to look at the amount per unit weight of the plant material. So such collaboration will bring out a number of very good things and possibly even go into synthesis and see whether the pure isolate alone cannot be combined to form a tablet, capsules, or something, even injectables. So I will seriously welcome any collaboration with the orthodox group. So that is what I can say about the research. But so far, there isn't any concerted approach to researching into sickle cell at the herbal medicine department. Right.
Okay. Thank you very much. We have about 8 more minutes. Yes, we have about 8 more minutes to go. Dr. Kobina, you wanted to say something earlier.
Yeah, yes. Good evening to everybody.
Good evening.
Good evening.
Thank you. Yeah, thank you very much for having me also on the program. This sickle cell phenomenon is something that has troubled many people for a very long time. I have a history about that as a patient of sickle cell. But I would say that it's about 5 decades now I'm free from sickle cell disease. About 5 decades. I'm 52. I'm 52. Around 2 years, my father discovered a plant, just a single plant. He introduced the plant into my bloodstream. Me and my siblings, and then it was just one touch. Up to date, we haven't had any single sickle cell crisis or whatsoever. We are doing so well. We have delivered our children. None of them have any issue concerning sickle cell. One of us is a lady. She has also delivered 3, and we haven't had any iota of sickle cell crisis.
Doctor.
Hello.
Hello, doctor. Sorry to, yes. So are you saying your genotype?
Hello. The line is not very clear. Please, can you position yourself very well?
Priska, you might have to move around. But Dr. Kobina, are you saying it has cured you fully, or it has cured you from the symptoms?
Okay, I'm narrating the story, and maybe you can make infer from what when I learned.
Okay.
What happened was this, that when I was 2 years old, this thing was introduced into my bloodstream. Then I survived ever since then, up to date. At the university education level, I entered the university education for medical exam. Sickling was tested, it was negative. Okay, at Winneba. I also trained as a teacher, so at Winneba, University of Education, Winneba. And I had to do my cognate program, which was HIPES, that is physical education. So I did that successfully with all the sporting activities. Nothing happened to me, and nothing has ever happened to my siblings. So I started using this same plant to treat a large number of people, having close to about 2,000 people treated.
Great.
Working so well. You can get about over 90% that are so well. They are doing well. Some of them for decades now, because I started 1995. Treating them with this traditional preparation. It's only from a single plant, just a single plant, one source. And it works so well. I think one of my, one guy just exited. I don't know whether he's still on the line, but I treated his children, 2 of them, probably about 2 years ago, and they're also doing well. There are many people that have treated. I think that Africa, we can have something. And Dr. Sam, I've been a student in KNUST, short programs on herbal medicine, and I hope that is Dr. Sam talking. He taught me on herbal medicine and their preparation and so on. So from there, I gained the knowledge in how to prepare safely. And now I'm using that, but it's not prepared to be on the shelves. So I just prepare I use it and then I discard. That is what I do. So for now, I would say it is at the crude stage. It is still purely traditional, hasn't gone through any, let's say, deep scientific research and preparation. I would say that, yeah. But this crude method is working so well. That is what I have. And I think we must help other people survive the same way I have survived with my siblings and other hundreds of people that I have treated so far.
Hello. That's great. That's
yes,
great.
sir.
Hello. Please, can I continue? Yes, please. If this gentleman talking, if he could kindly release this herb that he's talking about to our researchers, say Dr. Sam and his group, and then also maybe the people at Center for Scientific Research into Plant Medicine, Ekuyape Mampong, for them also to do more researches into it, so that his zeal to help the masses can actually be manifested. Because with this one, we can actually tell, just as you were saying, our kidneys are also very important, which we need to guard against. So nobody knows if there are other compounds that are in there that may harm in the years to come. Yes, so that would be my appeal to him. Yes.
Yeah. Thank you very much. I agree with you. I agree with you on that tangent that more research will have to go into it. But like I was saying, there must be a research, as you're saying. But for now, for me, I have been the guinea pig of the whole show. I was the first person that was treated. So I myself have been the biggest guinea pig so far that has taken it, and then my siblings too, and then many other people. And it has been several decades now. Or if we have lived up to 50 years without any problem with our kidneys, because we have checked all those things. I have other guys in a laboratory who are doing those checks. Anybody who comes to treat, they are passing through the system. They are watching them. They are trying to see if there will be any side effect. That's what we are doing. So we're actually doing some research that people are taking it. People are voting, they are dedicating themselves the same way I did. My father did for me. So we are using ourselves as guinea pigs and trying to see if there's something that will come out. And like you said, Mampong, yes, good. We'll have to sit down with Mampong. But it's something of this nature. We need to have trusted parties coming in. Because I release the plan to you, by the end of the day, you claim it doesn't work, but later you tell me, you tell the whole world, I've got something for sickle cell. Then you sideline me. You see, these are some of the problems. Hello, are you hearing me?
I perfectly understand you. So, for example, Dr. Sam could help. I know the Pro-VC of Kenya University, for example, is also some way, somehow interested in sickle cell. And so we could come up, sit all of these people down, we sign an agreement with you, and then it's done, provided there are some funds to actually carry it out. That is also another side of the whole story.
Good idea. Good idea. Good idea.
Hello. Dr. Fabina, can we, how do I contact you after? We want your number and Dr. Sam's number also, so we can link you guys together.
Okay. So can I mention the numbers or?
Yeah, sure. Please mention your number.
The numbers, please.
Go ahead.
Okay. All right. 020.
Okay.
953.
Okay.
1632.
Okay. So we'll contact you later on.
Okay.
Thank you.
Okay.
Thank you very much.
You're most welcome.
Okay. Dr. Sam, okay, I'll get your number from Dr. Mr. Amponsa later on.
Yes, that one you can.
I was going to comment on the safety, security of the plant he's talking about. Hello?
Yes, sir. What were you saying?
Hello?
Yes, sir. Dr. Sam.
Can you hear me?
Yes, we can hear you. Oh, your line is breaking again.
I don't know, but
the line has gone very, very bad.
Is it okay now?
No, it's very, very bad.
Now?
Okay, yes. Let's try it again. Go ahead.
Okay, let me just.
Yes, you're fine
is
now.
It okay?
Yes, sir.
Yes, a brief one on the security of the plant is talking about. Now, can you hear me?
Yes, sir.
Whether I am dead or alive, if it's going to work as a team collaboration, what it has to do is to code the plant. You see?
Yes.
Hello?
Yes, sir.
It should code the plant. Code the plant and bring it in a form that will not be easily identifiable.
Yes, sir.
It can do that. You don't need to bring the whole plant fresh or even dried and whole plant. No. You can put it in a form that scientific work can be done, but still not easily identified. For example, you can, depending on how you use it, bring it in the form of a powder and then give it a coat until thorough work has been done. It has been certified that yes, we've done the work. It has worked. Everybody is certified that it has worked. Then we can go into proper cooking and where the identity of the plant can then be made. This is what I want to say about the security of the plant that is talking about.
Okay. We have a question from Dr. Tansu.
Very honest. Okay.
Dr. Tansu.
Yes, thank you so much. I have two specific questions about this herbal medication. Hopefully everyone can hear me.
Yes.
Okay, the first is, were the individuals who have been taking this herbal formulation, were they clinically diagnosed as having sickle cell with actual clinical evidence from electrophoresis perspective that they had specifically sickle cell? And two, were they cured or were their symptoms mitigated or alleviated? That I could not get from the presentation.
I think that's for Dr. Kobina.
Yes, sir. Yes, can I answer here?
Yes, sir. Please go ahead.
Okay. I mentioned that when I was treated, okay, I didn't check it out. But during my university education medical exams, I was tested negative for sickling, but I was a sickle cell patient with serious anemia, and I had my spleen almost infected. My stomach was bloated. It was a serious problem that I've always been carried to the hospital every now and then until that herb was used. But during university education, I was tested negative. That is what I had. Then I had other patients also that later their system turned from SS into AS. They even dropped the report on my platform. I have a platform for this sickle cell treatment. Then they dropped a report there that shows that, in fact, they went testing and it turned out that this time they are AS. And ever since then, they have never had any problems. That is what happened. There was one also patient that his own turned into AA within 12 months. But the fact is that I don't know whether with time, it may revert back to, for example, from the AA back to AS or back to any other genotype. I don't know, but at least they are well. They are well, and they are doing so well. They can do whatever they couldn't have done previously. So that is the stage now. Yeah.
Thank you.
Please, can I talk? Yeah. Please, can I talk?
Yes, please go ahead, sir.
Please, doctor, the one who just spoke, the one who says that the medication. Yes. Yes. You need to. I don't dispute all that you are saying, but all that you are saying, they are just like they are not, there are no scientific basis behind them. Now we want scientific basis to be behind all that. So just as the woman from US asked the question, were the people that you treated, were they scientifically identified as being SCD persons? The electrophoresis test done and all that. How long was all that? For him himself saying, when he was talking, he said he was 2 years. 2 years couldn't have been long enough a time. And then I don't know if he's 50 years. At those ages, there was no proper scientific researches that have gone into sickle cell for people to be able to make like decipher whether this is this or that is that. So please, let's try to do the right things that will help the masses. If really you want to help the masses, then let's try to do the scientific approach. That will be the best option for us. So if you can, for example, do as Dr. Sam was suggesting and all that, yes.
I agree with you. I agree with you perfectly. As for the patients who have been coming to me, they take their test in the hospitals that they have been going, either Kolebu or whatever it is. They take the test, they present it to me, and they agree that they have that sickle cell before we start treatment. In fact, you bring the report before we start treatment. Okay, so actually people...
Actually, please, my experience so far has been that if you do the lab test once and it shows, it may not even be it. You may do it at a different lab and a different result may show. So it has to be done about 2 or 3 different times at different places to be able to confirm. That is what I have found so far. So let's try
with you. We will do it scientifically. I agree with you. I agree. But what I'm emphasizing is that those patients that come to me, they are registered sickle cell members in either Kolebu or any renowned government hospital that they have been going for their meetings. They have been diagnosed there. I don't diagnose them. Okay? If I diagnose them, it may be that my system are faulty, but I take it that they have sickle cell. I just apply something and then I draw conclusions. They take their test from wherever they take it from, renowned hospitals, not even private labs. Renowned hospitals, they agree that they have the sickle cell. They have been going to the sickle cell, programs and whatever they organize for them, perhaps every week or every month in the hospitals, the rich hospital, they have been coming from there. So I don't even diagnose them. They do the diagnosis from the hospitals where they have been registered as patients of sickle cell, okay, before I treat them, okay? But I like that you are saying we should go the scientific, and we are looking for, like Dr. Sam just said, there must be trust and how to go about the thing so that it doesn't happen that somebody discovers something and then it becomes somebody else, fame, So that is the whole idea. But I agree with you. Everything must be scientific. I agree.
Thank you. I think we have the number. So we'll share with Dr. Bankas and Dr. Sam. And then you guys can just collaborate and we'll see how we can take this.
Okay.
We are short of time. We have a few more questions on the platform. Someone asked, what would a person living with sickle cell disease look out for when choosing a herbal preparation? And the second question is, what is your advice on accepting a recommendation from a health professional, knowing it's a multi-million-dollar industry? So I think the first question is, what should you look out for when you're choosing a herbal preparation? If any of panelists or Dr. Sam can answer.
We look for in our herbal preparations. And like I said in the first instance, you need to know who is doing the preparation. You must know the source, the person.
Dr. Sam, your line is very, very bad again.
He needs to understand. Yeah. Hello.
It's still quite bad.
It's very bad. Okay, let me get around.
I barely hear you.
Right. Is it okay now?
Okay, let's see. Yeah, I think it's a little better, yes.
Is it okay now?
Yes, it's better now.
Hello?
Yes, please go ahead.
It's better. Yes. What do you look out for is the source. That is the first thing. Who is actually giving out that medication? What is the person's standing? What is his understanding of the disease? This is very important so that we don't take anything from just anywhere. We have to understand the person, examining the person very well, and know his standing when it comes to understanding of the disease. Then you also have to question, how should I take the medicine? What is the dosage? And how did you come by the quantity you are asking me to take? You should be able to ask the person that question. And the person must be answering. If he's unable to answer, and he's just saying, oh, just take about 1 cup and next time take a half, then you should be very uneasy about such a medication. Okay. I think this is very, very important right from the start. And then when you take the medication, like I've already said, you are going to take it maybe 2-5 days, just even the first and second day. Make sure you really examine yourself, look into your body and see if there is anything untoward happening. If it does, you better discontinue and go and inquire from the person what you should do. If it is established institution like the center or the herbal medicine department, I don't think you will need Sophia, because people there are ready identifiable, they are qualified people, and they know what they are giving you. But aside that, anything taken from individuals and not well-established places, sometimes people go to spiritual churches and they also attach medications to their prayers. I think there is a serious suspicion in those areas, and we have to be very careful.
Okay, thank you. And someone would like to know if there's any negative effects of the herbal preparation to take note of.
Oh, herbal preparation in general or just for the sickle cell?
I think in general.
No, in general, yes. Like all other things, we know even excess water is dangerous to the body. Yes. So there are side effects. If anybody tells you that as for herbal medicine, they don't have any side effect, no, I will never agree to that. Sometimes the side effects are so minimal that they are not detectable. And that's okay. And there are other preparations whose side effects are said that is readily detectable. In fact, people have taken medications and right now, vomiting, diarrhea, they happen. So there are some side effects to herbal preparations. Nobody should make it a blanket statement that as for herbal medicines, they don't have any side effect. No, it's not like that at all.
Okay, thank you very much. Dr. Bankas, your hand is up. Your last question for the day.
Yes, someone asked about what recommendations people should take, seeing as it's a multi-million-dollar industry. And yeah, Dr. Sam has responded to the part about herbal medication, but I think that in general, we need to also look at whether whatever medication has gone through the thorough and rigorous scientific process. So has it gone through and come out successfully of clinical trials, such that there's a lot of good data supporting it? Because often when we are using any medicine, or when any new medicine comes, is developed, it needs to go through several stages of clinical trials. They'll tell you whether it is safe, whether it's efficacious, whether it can be used in children, whether it can be used in pregnant women. They'll tell you about the studies and the proportion of people who get side effects and what can be done to mitigate some of the side effects, etc. So when you start seeing prescribers or health workers recommending certain medications, the least you can do for yourself is at least go online and check what the standard of care is for the particular condition. So in our case, sickle cell disease, what is the standard of care? And then find out whether it is a safe and efficacious medication. So that it's not like a health worker is maybe benefiting from prescribing that medicine to you. That is why they are prescribing it. And as we've said, within the context of this African or Ghanaian setting, there has to be a good interplay between our orthodox and traditional belief system, because we know that our people believe strongly in these traditional medications. And so if you have a patient sitting in front of you who will not accept your orthodox medication, rather than letting the patients completely not come for reviews and not be attended to within the healthcare system, you have to meet them halfway. So if there is, and now they are graduates from the herbal medicine school, if you have that available wherever you are, you can liaise with them, because from what Dr. Sam has said, some of these medications have active ingredients that can help with the vasodilation and reducing the sickling that happens, so that then we can have some kind of interplay between us, all in the best interest of the patient. So again, I think that this session has been very good and we've all learned a lot. But then whatever the case is, we need to listen to our practitioners. So if you are also taking anything, any herbal medication, please tell your doctor, because sometimes these medicines interact. So I may be giving you medicine and we think it's not working, but then it's because you've started taking something else from the herbal medicine practitioner. And then they also think their medicine is not working because you are taking something from me. So it's important that we discuss these things openly. But then for me, fundamentally, what we as people living with sickle cell disease need to remember is that we need to move away from this symptomatic management of sickle cell disease and aim for disease-modifying medication, because that is what will address the sickle cell disease and stop all the symptoms we are getting and all the complications we've been getting. Thank you very much.
Thank you very much, Dr. Bankas.
Yes, sir.
Dr. Sam, you had something to say before we close?
Well, not very much, except that I would say there are now myriad, I don't know how many of them, I can't even count, of herbal clinics parading and on the telly everywhere, claiming to be experts in various diseases. Some of them, I visit them and you realize they don't even understand what they are saying. That is the truth. Even though I very much in the realm of herbal medicine, working with them, trying to improve them, there are things that are in real life situation, they are real, and I don't think we should take it lightly at all. And so if somebody has got modern gadgets of advertising beautifully on the telly everywhere, that he has all the panacea for everything, I think we have to be very careful, not just sickle cell alone, but for all other conditions, we have to be very careful with the modern, particularly the modern clinics. Some of the proprietors don't even understand what is going on there. They just put the place up and they employ people. And we having a lot of problems with some of them. So we have to be very careful. Yes.
Thank you very much, Dr. Sam. You've been very, very helpful to our talk today. And Dr. Kobina also, thank you very much for joining. We've given you Dr. Kobina's number to Dr. Bankas, so I'm sure she will link everybody up so we can see the best way forward. Hopefully, this will lead to something very fruitful for everybody.
Right. Thank you very much.
Thank you.
Thank you, everyone.
So this recording is going to be on our Facebook page and our YouTube page. Just look for Sickle Life on Facebook and YouTube, and you'll see the recording, so you can review it or share it with someone who might need to hear this. We've gone far over our time. This is usually an hour, but this was so educative that we've gone almost 2 hours. Sorry for going over, but we really appreciate all our panelists, everybody who spoke, and all the education we received today. So hopefully in about a month, we'll have our next conversation. Hopefully we can have everybody here again to listen to us. Thank you very much, and have a good evening. Stay warm and stay dry from this rainy weather. Thank you.
Right. Bye-bye.
Thank you. All right. Hey.